Hi, Dr. B.
Hi, how are you today?
Good, thank you. Hello, everybody. My name is Dr. Tolulope Alugo from St. John Cap. I'm a child and adolescent psychiatrist. And here at St. John Cap, we aim to empower youth mental health by providing education to parents and caregivers. Today, we're focusing on the physical health of our kids because obviously, for you to have good mental health, you also need to be physically healthy. I have a great colleague here who's going to introduce herself and then we'll kick off. So, Dr. B, over to you. Just tell us about yourself, where you're based, what you do, and then we'll start chatting.
Perfect. My name is Dr. Wendy Ballenger. I am double boarded in internal medicine and pediatrics, and I have a direct primary care clinic in Olive Branch, Mississippi. And so, for what that means for us is the direct primary care is it's a relationship with me and the patients, and so I don't take insurance. It's just a monthly membership fee.
Fantastic. That's
Yeah,
really that's a neat model. I
it is.
guess it's different from here in Canada where it's socialized healthcare all covered by the government. But
That's
I know
right.
the US is kind of heavily dependent on insurance companies. So I
Yeah,
think it's neat that people have that option of just seeing you directly. That's fantastic.
that's right.
Okay, so how would you describe a child who is physically healthy? What would that child look like?
Well, it does depend on their age, right? And so, basically, a child, we just look to make sure that they're meeting their milestones, right? And so, at each different age range, they have different things that we expect them to be doing, So, like when they're first born, they're not doing very much, right? They're
Mm,
like, what the crap just happened? I was in a nice, warm, lovely place, and now I'm out, and I'm going to start crying because I need my food that was given to me all the time. And now I need it to be given to me every 2 to 3 hours. I also want to sleep, but I don't want to sleep because I got so much to learn. Oh, and I think I pooped too. So and so babies have very different physical attributes that we look for than like toddlers, adolescents, children, teenagers, right? And so babies, we just want to be sure that they are, latching either to the breast or to the bottle, that they're getting the food that they need. We really watch how they grow. Are they gaining weight appropriately? Are they gaining height or length appropriately? Is their head growing right? Right?
right.
And then as they get a little bit older, parents will notice, hey, are they watching me? Are they tracking? Like, are their eyes moving all the way across? Are they bringing their hands together? Are they getting to a point where they're rolling? Are they crawling? Are they pulling up to walk? And like, these are all progressive steps as children get older. So it does depend on the age. And, I personally have a cheat sheet that I look at and I can show you. It's kind of like a chart that I look at. Hey, what should they be doing by when? Um,
Okay.
yeah,
Wow, I mean that's fantastic. I know, I mean you'd expect that maybe about 6 weeks they should be kind of tracking, am I right?
hmm
And maybe neck
so
control, maybe
yeah,
soon after that.
so about 2 months old, they should be able to lift their heads up about 45 degrees, right?
Right,
But they
right.
might still have a lag because
Mm-hmm.
their heads are huge when they're babies. And so it
True.
takes a lot of neck strength to really maintain that neck posture when they come up. And they don't really have it till they're, about 4 months old. And you may see at 4 months old, they're trying to sit, they're trying to get their truncal stability, but they might still be head bobbing. And this
Mm-hmm.
is when a lot of people want to start feeding them solid food, but it's not safe until they're not doing the head bobbing. Because if you try to
Right,
put a spoon in there, you could damage their gums.
right. Wow. Okay. And I know one question I always end up asking, particularly in my field, is were there any speech delays? So typically, what age would you be expecting them to, begin to be asking or talking, and how detailed should their speech be?
Well, that is a whole separate category too. So, 2 to 4 months old, they need to start making noise, like the cooing sounds, right?
Right.
And then they'll start squealing about 4 months old. They'll start babbling at about 6 months old, and that means they might make sounds like mama, dada, blah blah blah, but they don't assign a meaning to it, right? They're
Mm-hmm.
just starting to make um, concerted muscle working to make the sound like something that we would say, right?
Right.
And then when they're about 9 to 12 months old, that's when that they know, hey, mama is actually that lady. and Dada is actually that guy, right? And Baba is actually what I get my milk in, right?
Right.
Um, and so there are red flag signs. Like if they aren't babbling by the time they're 9 months old, that's concerning.
Right.
Right. And so that's when we would want, if they're 15 months old and they haven't had a first word yet, then we need to get some help, right?
Right.
Like speech
Okay.
therapy or something like that. Um, or a hearing test. There are
Mm.
kids that don't hear well, and for some reason, and it's possible they feel the vibration of stuff, so they'll turn and look when they feel steps coming, but they're actually not hearing. And so
Wow.
sometimes kids don't speak because they don't hear. Now,
Hmm.
in the US, and I'm assuming Canada is probably like this too, we give hearing tests to children before they leave the hospital.
Right.
We generally know, and then if they don't pass that hearing test, they'll go back in about 6 weeks or so and get another one.
Okay. Wow. Thank you for providing that detailed information. I didn't have my kids in Canada, so I'm not really sure. I can't even remember if they had a hearing test when they probably did. They were born in Europe, or
They
maybe I
probably
don't know.
did,
They
honestly. I
probably
mean,
did.
it's part of the standard stuff we do before we send kids home because
I would say
we
so.
want parents to be successful, right? We want the kids to be
Exactly.
healthy and to grow and to develop normally, and so that's part of one of the things that we can do because I don't know about your country, but our country sometimes our access to care is not great, and so women will come in and it's the first time they've been there. It's when they're having the baby. They don't have any prenatal care. They don't really plan to have any postnatal care, and
Wow.
so we try to do what we can when we have them.
Exactly. Wow. To give that as much comprehensive care as possible is what
Yeah,
I'm hearing you say.
exactly.
Okay. So after the baby is born, and what are the typical times you would see the baby again as they're developing? Are there specific ages that they will have to come back for checks
Yeah,
to
so
see you?
we have them come in accordance to when they're due for their vaccinations, right? So
Okay.
here we'll give them Hep B, a vitamin K shot, and the erythromycin drops at birth. And
Mm.
then we have them come back at 1 or 2 weeks, depending on whether they had jaundice or whether they lost more than 10% of their body weight at the hospital before they were let go. And then we go to 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 24 months, 36 months, and then yearly. And that
Okay. So
coincides with their vaccine record too, or
right.
their time that they need to get their vaccines. Yeah.
So yearly till what age? What age do they stop coming to see you yearly, or do they just have to come yearly till they're like 18, or how does that work?
I mean, honestly, I prefer everybody to come once a year, regardless of their age, at least. For
Right.
kids, it's good because a lot of times they need a yearly sports physical. And
Mm-hmm.
so, right at about 3 years old is when they will start their yearly coming in, right?
Okay.
And so, and that's still important because there's still developmental milestones that they'll need to reach after, up till about 6 years old. And then once they're in school, we talk about, hey, are they learning okay, right? Are they having any learning deficits? Is there a reason that we need to be concerned about, lead exposure or something like
Mm-hmm.
that, which isn't very common here anymore, but can still happen.
Sure. Yeah. Yeah. So you already spoke about the fact that if by 15 months the child doesn't have any words at all,
Hmm.
they need to get help. What other things should a mother be concerned about when it comes to a developing child? And how long should this mom wait before she goes to get help?
I think most moms have that mom sense, that spidey sense, hey, something's not right with my child. And I
Mm.
think that as soon as they feel that, they should come in, regardless of what it is. If for no other reason than reassurance, because it's
Yeah.
always better to be safe than sorry. But some other things, if they're 18 months old and they're not saying any words consistently, that can be a concern. Um, if they by the time they're two, if they can't follow directions, if you're like, hey, or take this piece of paper and fold it, they can't do that, then there might be some cognitive decline or delay there.
Right.
Um, Also, it's very important. So when they do start to speak, um, about at a year old, they should be about 25% understandable to strangers. 2 years old, it's let me make sure I'm telling you correctly here. I'm looking at my peripheral brain where I'm taking my notes, right?
That's
Um,
important.
yeah, and so usually by 3 years old, kids should be 75% understandable by strangers, right? So
Okay.
you as a mom, I know what my kids are saying, even though if it's gibberish, because you know their language, right? But a stranger doesn't know their little innuendos and their languages and that type of stuff. But by 4 years old, they should be 100% understandable. So if they're not, that's the time for speech therapy. And it may not be a matter of cognitive decline or whatever. It could just be lazy speak, and we need to retrain the tongue to actually enunciate the words properly.
Right, right.
Yeah.
Yeah. Do you find that sometimes kids are delayed in their speech if they're like the youngest in the family, they have older siblings who seem to be the ones who do all the talking for them? Do you
Absolutely.
ever find that in your experience that that's
Yeah, and
happening?
the other thing too is a lot of times if kids don't have to do something, I mean, our default setting is lazy, right? And so
Mm-hmm.
if I don't have to say anything and I just point and you give it to me, then why would I speak? Why would I waste
Exactly.
that energy to do so, right? I mean, you're giving me what I want without me saying it. So,
Right.
and if you have a brother or sister that's older that is, aiding in that, that helps too. A common misconception is that kids of bilingual or multilingual households have speech delays. They don't. They should not.
Hmm. Okay, well, I mean that's good to know because I talk to a lot of moms who are immigrants, and sometimes things are put down to that. That's the explanation for some delays.
Yeah.
So just kind of very enough to talk about kids who have special needs, kids on the spectrum, for example.
Mhm.
I know that going to see a doctor can be challenging, getting their checks done, getting lab tests, getting dental appointments done. What kind of strategies would you have in place, or what kind of advice would you have for moms of those kind of kids?
So there are different types of testing we can do if we're looking for things like autism or developmental delay. But so one of the things dentists really like is the second a child has a tooth break through the gum, regardless of the age, they like the child to start coming in. And it's not so much that they're looking at the tooth itself or the gum itself, although they can. Is to get the child used to going in there and having that exam, right? So to make it
Right.
part of their pattern or their schedule, and that can help because unfortunately dentists are super nice, but sometimes they're like the scariest people ever, right? So people are always like, oh, I don't know, I'm scared to go to the dentist or I'm scared to go to the doctor. And part of the problems we have as physicians is, we do set up their initial visits for times when they get their vaccines. And so
Yeah.
it's like every time they come in, they get a shot. So of course they're not going to want to come in because they know what's going to
Hmm.
happen, right? So just, I mean, there's a lot of teasing, unfortunately, that happens to kids that are getting shot. Oh, you're going to get a shot today,
Hmm.
And I think maybe that should stop. We shouldn't bully kids about getting shots. We just should just say, hey, this is to help protect you, to help keep you safe throughout your life. And we're so lucky that we have this science and this technology to give you. So you should be super stoked that you're getting this, right? Like build it up as a positive experience instead of a negative. And that's good for all kids of all
Yeah.
neurodevelopmental stages. Depending on where kids are on the spectrum with autism or Asperger's, we may have to do things like we may have to anesthetize them if they have to have like dental work, like a cavity filled or something like that. We may actually have to knock them out.
Wow. I mean, those are great strategies. I'm just going to recap. So you mentioned, taking the kid to the dentist right from a very young age when they begin to get their first tooth out so that they get used to the pattern. Normalizing getting shots and really explaining it as a positive thing such that the child should feel that this is something that, they would desire to have.
Right.
And then you talked about possibly needing to use other extreme or more more extreme measures if necessary. You
Yeah.
know, yeah.
And getting the child used to coming into a physician or a dentist is really important, and sometimes, the autistic children and adults that I have, a lot of times they'll come in and we don't do much at all. We just interact and we just say hello, and I don't even touch them. I'm just
Mhm.
having them be used to me in the same area. And being part of a direct primary care, I have more time, so I can spend an hour with a patient during our appointments, right? And so I can really take that time to build that trust, so that they're like, you know what, it is okay if you listen to my heart with your stethoscope. It's okay if you touch me there or whatever, right? Or you look in my ears. I don't think you're going to hurt me. I haven't gotten that feeling off of you this whole time. And so having the time to kind of assuage some fears really helps. And we can have them come back much more often in this model of medicine too. And that also helps because, the familiarity kind of helps them calm down a little.
Exactly, building that into like a routine. One
Yeah,
thing that we always also suggest in mental health is using social stories. So there are books that talk about going to see a dentist or going to see a doctor, what to expect, and then that kind of prepares a child for that experience. So using social stories, videos now on YouTube, or a picture book.
absolutely. And unfortunately, it sounds like you're going in and out a little bit for me.
Okay, I think we kind of
Oh, there you go.
yeah. Yeah, we're back now. Okay, so I know that you are a doctor of osteopathic medicine.
Yeah.
Yeah, can you tell us a bit what that looks like when you see kids in your practice?
Yeah, so osteopathic medicine, we believe that if you are in anatomical alignment, then you're better able to deal with any type of medical issue. If you need to take medicines, your body metabolizes it better because now you're in alignment. Everything can flow properly, including your lymphatic system, your blood system, all of that stuff, right? Things work better. They're not having to fight against being in misalignment as well as the disease and breaking down the meds and stuff like that, too, right? And so for kids, the thing that I use the manipulation for, and what that is it's a gentle realignment of bone, muscle, soft tissue, lymphatics, that type of thing. So yeah, I can pop people back into place, but I actually tend to slide them back in. So it's much more gentle.
Right.
There's not going to be a risk of ligamental damage like there could be with other groups that maybe use a lot of force. We don't use a lot of force, right? We try to use the anatomy and physiology to realign it properly. And
Right.
so one of the places that it works really well for kids is kids that have scoliosis or a slight curvature of the spine. Sometimes they'll have back pain or they'll feel like they're walking weird or whatever. And if we can realign them, we can help them with that. Headaches, sinus, we can do sinus drainage that helps them. There are some kids that, we want kids to be laid on their back to sleep because it helps prevent SIDS or sudden infant death syndrome. And so,
Hmm.
but if they lay on their back too much and they don't have enough tummy time, then they could have the flattened back of their head, right? And so doing a little bit of cranial can help reshape that head, you know? Yeah.
Wow.
So we can do
Well,
a lot of different things. And, it's something that we do discuss with parents. Hey, this is what we're going to do. Are you comfortable with this? Nothing that we do should affect their growth plate or anything like that in a negative way.
okay. That all sounds great. I mean, just being able to have those other extra options
Yeah.
in your treatment plan. Okay, so I know your clinic is based in Mississippi. Am I right?
Yes.
Yes,
Mississippi.
it's Mississippi, and I know your website is www.charmdpc.com,
Yes, ma'am.
and it's Charm Direct Primary Care.
Yeah.
Right, right. So, and do you have any last words for that mom who's worried about her child's physical health or how to proceed before we wrap up today?
Sure. I mean, I think it's awesome that, sometimes we get parents who don't care, right? And it's wonderful that we have parents that do, and that is the majority, thank goodness. And you aren't alone, right? I mean, when you have child and you're worried that you're messing them up, you're not, okay? But it's good that you're worried about it because that means you're taking steps to be a wonderful parent. I have a young mother who was worried because she had a diaper rash, and she hadn't had a diaper rash in this baby. She had taken such good care of this baby. She hadn't had a diaper rash until she was about 5 months old. And you know how hard that is.
Yeah.
And diaper rashes happen because babies poop and pee all the time. And
Hmm.
trying to keep them in a dry diaper is virtually impossible. Right.
True.
And this mom is a working mom, and and she's taking such good care of this baby that she felt so bad that her baby had a diaper rash at 5 months old. And I'm like, you are a stellar mom. You are kicking butt and taking names, right? Like, you're doing so wonderful. So you are most likely not doing badly at all. The biggest issue is to be there for your kids.
Yeah.
When they need you, be there, be present. Listen to them when they get older and they want to talk to you about stuff. Maybe at dinner time, turn off the TV and have conversations about their day and really be engaged with them as people in their life and help them with school and, those types of things, you know?
That is such great advice. We always say that, a kid doesn't need a perfect mom, they just need a good enough mother.
Yeah.
The good enough mother is what we're all kind of aiming for. Thank you very, very much, Dr. B, for spending this time with me. This has been so informative. I've got so many strategies I can go away and try in my family, as well as people that I see in my practice. Advice I can give about going to the dentist and the doctor, when to get things checked out when you're worried. So that is all invaluable advice, and I am really grateful. Thank you very much.
Thank you.
Have a
It was wonderful talking to you too.
great talking to you.